Now we'll come to the point, mobility of the vertebral column. Here, if we take vertebral column, how many movements are there? Okay, in cervical we are having flexion, extension, lateral flexion and rotation. Thoracic spine we are having lateral flexion and rotation. Lumbar spine, flexion, extension. So these are the movements. So finally, whatever we see, flexion, extension, lateral flexion and rotation. Okay. Now we'll see overall about flexion. Overall about flexion. What is this flexion? What will happen during flexion? Okay. Already we know, if you know what is the stability, then automatically we'll understand what is this flexion. So if once the vertebra is going for flexion, see here, if the vertebra, this is anterior, this is posterior. If the vertebra is going for flexion, vertebral column, so anteriorly there will be a compressive force between the bodies of vertebra. So see here, this is the body of the vertebra, this is the body of vertebra, this is the body. So between these two bodies, there is a compression, there is a compressive force between the bodies of the vertebra. At the same time, compression of anterior portion of annulus fibrosus. So here there is a nucleus pulposus, this is annulus fibrosus. So in this intervertebral disc there is a compressive force over the annulus fibrosus, and at the same time anterior longitudinal ligaments. Here we'll be having anterior longitudinal ligament also will go for like little loose, it may go for little slack. Okay, this is about anterior structure. So if we go to posterior, what will happen? Okay, if we go to posterior, so here the space between spinous process will increase. At the same time, here you see vertebral foramen. Here it is more, here it is little less. So that means if flexion is more, the vertebral foramen for the spinal cord will increase more. So it is going to widening the vertebral foramen space. At the same time, it is going to, so here flexion, it is going to stretch the posterior longitudinal ligament. At the same time, supraspinous ligament. So here we will be having supraspinous ligament, here we will be having posterior longitudinal ligament. So posterior longitudinal ligament will stretch, supraspinous ligament will stretch. This is interspinous, between the spinous process. Interspinous ligament will stretch. At the same time, ligamentum flavum, where we can see this is the body of the vertebra, this is the arch of the vertebra, spinous process and transverse process. So this is the vertebral foramen. Here we can see the ligamentum flavum. So ligamentum flavum. So here also the ligamentum flavum also will stretch. So these and all will happen when a person is doing vertebral column flexion. At the same time, special points. At the same time, here some special points are there. When the patient is doing this flexion, doing this flexion movement, the Gmax, gluteus maximus. What is the action of gluteus maximus? Hip joint extension. So understand, if the patient is doing vertebral column flexion in standing position, automatically hip joint will go for extension. So because of this hip joint extension, always the Gmax muscle in this extension, the Gmax muscle which is present here. Suppose if this is a belly, so this is a spine, this is a back, so this is a hip joint. Okay, this is the imagine hip joint, this is buttock region. Okay, gluteal region, hip joint, knee joint. Okay, this is the one patient. Okay, this is the one person. So this is our hip joint, this is anterior, this is posterior. Here we are having Gmax muscle. If the person goes for flexion, if the person goes for spinal flexion movement, that time the hip joint will go for extension movement. At the same time, because of the contraction of the Gmax muscle, if the Gmax muscle is always try to pull down this pelvic. So because of this pulling force, the spine will not go for further flexion. So because of the downward pull of this one muscle, Gmax muscle, the spine will not go for further flexion. Then again it will come back to neutral position. That is one. And second point, thoracolumbar fascia. So the presence of the thoracolumbar fascia, suppose if we take, this is our spine, this is an anterior, this is posterior. So this is our pelvic region, thigh region. Okay, pelvic region, thigh region, knee joint. Okay, then this is our patient. Okay, this is anterior, this is posterior. So here will be hip joint. Okay, this is a thoracolumbar fascia will be here. Okay, this is thoracolumbar fascia. Because of this, the thoracolumbar fascia, if the patient is going for flexion, the pull of the thoracolumbar fascia is again it is going to prevent the further flexion in the vertebral column. So because of the pull of the thoracolumbar fascia, also patient will come back to normal position. Without going further flexion. So these things we should observe in the flexion movement of the DC. Okay, now we'll see extension. Okay, this is the second movement, extension. If we know flexion, it's very easy to understand extension. We'll finish it in 1 minute. Okay, so here we are having extension movement. If the patient is doing extension movement, so here what will happen? First one, spinous process will come closer. Spinous process will come closer to each other. At the same time, here vertebral foramen will become narrow. So here this vertebral foramen size will become less, and posterior portion of the annulus fibrosus will be in compression. Posterior portion of the annulus fibrosus will be in compression, and nucleus pulposus will move forward. Nucleus pulposus will move little forward, not complete, little forward it will move, and space between, okay, and space between vertebral bodies will increase. Here space between vertebral bodies will increase because here we are doing extension movement, okay. At the same time here if we take posterior ligament, PLL, posterior longitudinal ligament, interspinous ligament, supraspinous ligament, ligamentum flavum, and facet joint. So all these structures, facet joints and capsule, all these structures will be like loose, simply you can tell it slack, okay. And here one legend is there in this extension movement. That legend name is ALL. He is the king of this extension movement. So anterior longitudinal ligament. So the entire extension movement will be controlled by the anterior longitudinal ligament. This is the only one ligament which is going to prevent the further extension in the vertebral column. So this is about the extension of the VC. Now we'll see side flexion. Now we'll see lateral flexion, nothing but side flexion of the vertebral column. So what it means here, nothing but the superior vertebra will rotate over the inferior vertebra. Superior vertebra will rotate or tilt over the inferior vertebra. Suppose here imagine green color is the inferior vertebra. So here red color is superior vertebra. So here the green color vertebra, here it is inferior vertebra, means that it is in resting position. Okay. So red color is superior vertebra. So here lateral flexion means superior vertebra rotate or tilt on the inferior vertebra. So this is neutral position, green color. So here from this neutral position, the red color vertebra is tilted and rotated. So this is nothing but the lateral flexion in superior view. Suppose if you see in lateral view, this is our thoracic vertebra. Suppose this is right side, this is left side. So if the patient is doing side flexion, what will happen? So here between two vertebrae here will be having IVD, intervertebral disc. So this is concavity. This is convexity. So if the patient is doing left side flexion, the left side of the trunk will go for concavity. So like this, okay, concavity. Right side will come for convexity, concavity. So here IVD intervertebral disc will be compressed over the concave side, and it will be stretched over the convex side. And at the same time here we should understand about ligaments. Here we will have a transverse process. So here intertransverse ligament, between two transverse process will be having intertransverse ligament. See here, this is one transverse process, so these two transverse process will come from the arch of the vertebra. This is one vertebra. So here imagine here one more vertebra is there. So here we'll be having body of the vertebra. This is the body of the vertebra. This is vertebral foramen. Here again one more transverse process. This is another vertebra. So between two transverse process we'll be having intertransverse ligament. So here intertransverse ligament in this concave side, which side patient is doing left side. So left side intertransverse ligament will go for shortening, and right side intertransverse ligament will go for lengthening. Understand the point? So because of the lengthening of contralateral opposite side ka intertransverse ligament, the side flexion we will not be able to do because of the stretching of this intertransverse ligament. At the same time, the stretching of intertransverse ligament is going to increase the space between transverse processes of the vertebra. So here if it is neutral, if it is bending like this, lateral flexion, if it is bending like this side transverse process will come to each other, okay. This side transverse process will separate from each other. So this is about the lateral flexion of the vertebral column. Clear? So this is about movements, okay. Flexion, extension, lateral flexion, rotation, okay. Rotation will be having also here rotation of the same here only, because here we told lateral flexion is nothing but superior vertebral rotation or tilt. So if the patient is doing rotation, that time which structure will resist more rotation means facet joint. So here suppose 4, if we take rotation here, facet joints and annulus fibrosus, intertransverse ligament, and okay, these are the three structures. So these three structures are the main structures which are going to prevent or resist the further more rotation on the vertebral column. So these are about movements of VC. Clear?